Dr. Dean is a medical doctor. She's also a naturopath, herbalist, acupuncturist, nutritionist, lecturer, author. She lives in Hawaii. Oh, well, good for you. Just going around our local health food store and farmers markets and grass-fed meat and all that. Don't we get enough magnesium?
Nope.
Nope.
No, we don't.
How come?
And, well, your last interview sounded like it was about soil and soil depletion.
Mm-hmm.
And what's happened with the minerals in the soil is if they are not replaced with fertilizers that contain these minerals, you just aren't going to get them. And you take something like Roundup, Monsanto's Roundup, Ready herbicide, the chemical glyphosate is binding minerals. It will bind magnesium, removing 50% of it from the soil. But, I mean, it's not even there anyway. And then Roundup has a half-life of 23 years. So you take the fact that we're using the herbicides, not replacing them. No, but what we have, again, from the USDA, they have all these facts and figures. You just have to dig for them. But 100 years ago, we were getting 500 milligrams of magnesium in an average diet, and now we're lucky to get 200. And the RDA is like maybe 300, 400 milligrams. But I'm seeing now that people probably need 2 and 3 times that amount. We're burning it off at incredible rates. If you have mercury in your mouth or mercury toxins in your body from vaccines and etc., or just breathing, if you live near a coal-burning plant or in a crematorium, you're having mercury in your body that competes with magnesium and interferes with magnesium, which is biologically in the body, it's got at least 325 enzyme systems that it's responsible for, including energy from ATP. If you don't have magnesium, you don't have energy. And then, it goes downhill from there. You've got drugs now. About 50% of the commonly used drugs are bound with substances that are incredible. I mean, when I tell you that fluoride is used in 50% of the drugs, just to make them more active, and then you find that fluoride binds magnesium, kind of like mercury does, and makes it unavailable. You've got a drug like Cipro, and Cipro will cause tendon rupture. But before that happens, you get muscle pain, you get muscle spasms to the point of tendon rupture. That, I believe, is from a magnesium deficiency caused by this antibiotic. So we've got the drugs, we've got the fluoride in the water, we've got chlorine in the water that will do the same. So then we've got the incredible stress that people are under. If you're an athlete and you're sweating out magnesium, but you never replace it. I mean, I could go on and on and on with 100 different reasons why magnesium can be depleted in the body.
So having said that, what's a fellow and a girl to do? I mean, we hear about, Georgia was talking a lot about vitamin C and how important these things are, but just because something's good and we need it, if we go to the health food store and buy it and start taking it, is that a good idea as well? In other words, I'll spend an hour with you and I'll say, man, I just need to take some magnesium. Listen to all this stuff this doctor said. Is that a reasonable thing to do? I mean, just to go out and take extra magnesium and without knowing anything?
It actually is with magnesium, Patrick, because what's happened with magnesium, it's got an incredible, what I call a failsafe. We can look at evolution where humans grew up near oceans. And in oceans, there's at least 3 times the magnesium as there is calcium. And they're a sister pair of minerals that work together, but they also, beat each other up. So what happens with evolution is magnesium failsafe is the laxative effect. If you get too much magnesium from your seaweed and your fish and, all the magnesium in the soil around oceans, then it protects you from any side effects, whereas calcium does not have a fail-safe because when we grew up evolutionarily, we needed to bind up as much calcium as possible because it wasn't so available. As I said, we've got way more magnesium in seawater than calcium. So we developed vitamin D, which is a hormone, not a vitamin. And this hormone, vitamin D, grabs calcium in order to make it more available. But what has happened in the past 50 years is we've given people more and more calcium. We've forced every woman to take high calcium supplements beyond their requirements and beyond their ability to process, to the point where now we've calcified people. We've got the studies the past few years, British Medical Journal, showing that women who take calcium supplements are at high risk for heart disease, and we've seen this happening. We've always wondered, well, why are women developing more heart disease all of a sudden? Well, it's the calcium, and women are developing breast calcifications and gallstones and kidney stones and heel spurs by this calcification. We've fortified food with calcium, but we've ignored magnesium. And partly that's because we don't have good measurements for magnesium, so doctors have ignored it.
So a lot of this calcium over the last 50 years have ended up in the arteries and other places where we don't want it.
Exactly.
So overall, we probably don't even need to think about taking extra calcium.
Well, when you look at diet lists, if people are eating even a little bit of dairy products, you get about 300 milligrams of calcium in in a yogurt, something that people now consider a health food. You probably only need about 700 milligrams of calcium in your diet, but our RDA is about 1,500. When you look at the UK and the World Health Organization, their levels for an RDA of calcium are 500 to 700 milligrams. So actually, I'm doing a third edition of my Magnesium Miracle book with Random House, and I'm stating in there, look, you can get your daily needs of calcium from your diet, but you can't get magnesium. You can soak in Epsom salts baths, you can take oral forms, pills, powders, liquids, you can spray it on, and you can follow it with a blood test that doctors really aren't using it, but it's readily available. It's called Magnesium RBC, and there are online sources for ordering your own test. If I can mention a site I'm not related to, but it's called requesttest.com. They have a $49 magnesium RBC test that your doctor probably doesn't even consider, because what the medicine does is a serum RBC test. Only about 1% of your total body magnesium is in that serum test, so it's an inadequate, dipstick for your magnesium levels, because the body will make sure there's enough magnesium in your serum at all times, because it keeps your heart muscle going. We didn't even talk about what magnesium does to muscles. It helps the relaxation phase and the quiescent phase of muscles and nerves, whereas calcium tightens up muscles, causes the contraction phase and the firing phase of muscles and nerves. So if you don't have enough magnesium and you have, therefore, a relative increase of calcium, your heart muscle is going to go in contraction and can cause angina and even heart attack. You've got athletes who will drain their bodies of minerals, including magnesium, on their marathons, for example, and end up having a heart spasm and a heart attack and die. And people will say, oh, I wonder what's going on there. And they're not looking at the electrical activity of the heart and the absolute requirement for magnesium. So you take vitamin D, you utilize more magnesium molecules, because people aren't talking about the fact that the storage form of vitamin D that you take when you take these high doses of vitamin D has to be metabolized into the active form, and what helps metabolize it is magnesium. I get emails, people telling me that, I took high dose of vitamin D, and all of a sudden all my magnesium deficiency symptoms came back. Or the worst, a worse scenario is someone who doesn't know anything about magnesium, and they take vitamin D and they get seizures and heart spasms and muscle spasms, and they don't realize that vitamin D requires magnesium in order to turn it into the active form. So I tell people, well, if you're doing vitamin D, if you're doing calcium, you're going to need more and more magnesium. And, you know, maybe the bright thing would be to cut back on those supplements that require more magnesium, get your magnesium in balance, and then take low doses or follow your vitamin D levels. I tell people to go for a low normal of vitamin D and a high normal of magnesium, because like I said earlier, Patrick, with vitamin D, if it's a hormone, which it is, hormones work on a biofeedback system. If your vitamin D is low, isn't that your body trying to tell you that, hey, maybe I have enough calcium and I don't need to grab more? Not taking enough. We seriously say to people, even with something like insomnia, where there are lots of advertisements about magnesium for calming you and for insomnia, and people will say, well, I take it and, you know, it helps a little bit. Well, take more. And that's where I can start saying this, you know, very clearly, because you can get a blood test. You can do your own magnesium RBC test and see whether or not you have the optimum. And I'll tell you, Patrick, what happens even with that blood test is they give a range, and the range is kind of like 4.2 to 6.8, somewhere in that range, is milligrams per deciliter. And as I said earlier, we want to be 6.5. We don't want to be 4.25, because that's what a doctor will say. If they look at the test and you come back with a 4.25, they'll say, oh, you're within the range of 4.2 to 6.8. And we say that range is taken from the sick population, 80% of who are deficient already. So why do you want to be there? Why don't you want to be optimum? And that goes back to what I said about the government, the NIH, when they're talking about supplements, it's got nothing to do with health or optimization. They just want to make sure you don't die because of frank deficiency.
Right.
Circulation is magnesium.
Is it?
Magnesium solubilizes calcium in the body, in the blood. It helps direct calcium where it's needed in the bone. It is part of the bone structure. Magnesium is part of the bone structure, which makes the bone, I'm not going to say rubbery, but it takes away the brittleness of a straight calcified bone. If you drop a bone that's just calcium carbonate, it shatters. If you drop a bone that has calcium and magnesium, it bounces.
So George was talking about the vitamin C and the getting rid of the keeping the arteries clean, Pauline's work, and all these people. Is there any problem with taking vitamin C and calcium together?
And calcium together?
No, I'm sorry, magnesium, excuse me.
No problem at all. I mean, they kind of interact, but I'm in agreement, I think, with what you were talking about, that the vitamin C out there that's been designated as vitamin C is really just ascorbic acid, which is only one of about 12 of the vitamin C complex components. So we're really not getting a good balance when we take just ascorbic acid. But at the same time, I'm on the board of the Orthomolecular Medical Society, where we put out newsletters about using ascorbic acid. And as a kind of a medication, it's doing incredible work. But at the same time, I tell people to take a food-based vitamin C, and that, along with magnesium, is very important for the heart function, for the adrenal glands. It's important for the way the collagen is produced. So all these supplements are critical, and although I've been accused of just being magnesium centric.
Mm-hmm.
I kind of stick with that because I'm still a generalist, because when you look at magnesium, and it does so many thousands of things in the body, magnesium is a generalist. And I tell people in my writing, in my consultations, in my interviews, just start with magnesium. People get so frustrated because they'll go to naturopaths now, and naturopaths, a lot of them are just green allopaths, where they look at a list of symptoms and they'll match up each symptom with a supplement. So you go home with $1,000 worth of supplements, and you're not even taking any magnesium because, I'd rather give an expensive esoteric supplement than magnesium.
Well, it's nice being here. We love having you on. And do you get to see whales there in Maui?
Absolutely. I have a 180 view of the ocean, and I see them jumping in whale season. It's awesome. And I swim with turtles. Yesterday, I saw 10 turtles within an hour.
Swimming with the turtles. Good for you.
And they're as big as me.
No kidding.